Mr. Derek Veenhoff.
He's better known as Deek.
Drinking liquor with DJ Deek, we out laughing.
Yo, Deek.
Hey, hello everybody. Welcome back to the channel, to the show, to the Deekast. This is your host Deek, and I'm here with Dr. Jonathan Howard. Welcome.
Hey, thanks for having me. I sure appreciate it.
And if I'm not mistaken, you're a neurologist and a psychiatrist, and you're based in New York City. Is that right?
That's correct. I do both neurology and psychiatry. I work at NYU and Bellevue. Bellevue is really my home base, the sort of largest and oldest public hospital possibly in the country. So it's an interesting job.
That's impressive. And you have become interested in vaccines, like you say, long before the COVID-19 pandemic. And so there's, of course, a lot that we want to ask you regarding all of that. But why don't you delve in a little deeper into your academic and professional background so we can get an idea of what you do?
Yeah, so my professional background has nothing to do with vaccines, except, other than most doctors, we try to encourage vaccines. The main thing that I do is treat multiple sclerosis and work on the neurology wards at Bellevue Hospital. I also do a lot of psychiatry. I work in the psychiatric emergency room at Bellevue. For a decade, I worked every overnight, Sunday night shift. I've kind of cut back a little bit on that, thank goodness. But, if you got drunk and took off your clothes and ran on the subway tracks, they'd bring you to me on a Sunday night. But I got interested in vaccines. It's hard to know exactly how long ago, probably about 8 or 9 years ago, when a doctor who I trained with at NYU, a woman by the name of Kelly Brogan, we were friendly. She's a very nice person. I haven't spoken to her in years, but she graduated the residency program in psychiatry with me and started posting all these anti-vaccine messages on Facebook. And that's really how I became interested in it. And unfortunately, her star has sort of risen very high. She's spoken with Gwyneth Paltrow and Goop and, gotten herself on sort of a lot of TV programs. And she's very famous in certain circles. She's become one of the disinformation dozen, if you're familiar with this. Yes. Entity, I think it's called the Center for Countering Digital Hate or something like this. She was one of the 12 people most responsible for, along with her husband, actually, anti-vaccine messages on Facebook. And the number of things that she believes that are odd, I could just sit here and go for an hour about these, right. But that germ theory doesn't exist, that viruses don't even make people sick, that the pandemic is all some sort of psyops operation, by God knows whom in order to do exactly who knows what. She's very clearly a dangerous person. But it was really her who sort of got me interested in the anti-vaccine movement. And I've been trying to counter it ever since. It has nothing to do with my sort of the daytime job that I just described of neurology and psychiatry.
Right. What was your personal outlook when let's say go back to December 2019 or maybe November? What was your first sort of inkling to know, okay, this is going to be a big deal, and vaccines are going to play a big part of this? And did you have any perception of the timeline of the vaccine in that from the beginning?
Yeah, so I had no special insight. I mean, the earliest I found myself commenting on the pandemic was late February, when someone posted on Twitter to doctors, "Are you scared about this?" And a lot of people were saying no. Happily, I said yes. I'm going to pat myself on the back here. I listen, I'm not going to say, and I remember around that time saying to someone at work that this will be a bigger disruption to New York City than 9/11. I said, you can't really compare those two things, but, we tend to sort of, draw on past tragedies. That was the only real reference point that we had. I said I think this will make 9/11 look like a walk in the park. And, obviously I don't mean to downplay that horrible day, in saying that. So I knew something bad was coming. In some ways, it hasn't been quite as bad as I feared. When I saw it was coming to New York City, I don't think there's a diagnosis called pre-TSD, but I had pre-TSD. I was having all these sort of nightmares of just, basically what they were experiencing in Italy at the time. I think just sort of bodies in the street almost, type experience. So in some ways that wasn't quite as bad as I feared. And yeah, obviously I knew vaccines were our only way out of it. They were developed in record time. I mean, I defer to people like Paul Offit, true sort of experts, who are saying, vaccines at the best are going to be a year and a half, 2 years away. So, we were all pleasantly surprised that 10 months, right? I mean, that's incredible. I call it the greatest scientific achievement of my lifetime.
Which is a great way to look at it, of course, but we know that a lot of people considered that to be, it was rushed, right? Which that line of thinking is incorrect. But you can see where people sort of got that, at least, or got some sort of intuition that they felt that it was rushed. Of course, you have the media as well with their late night headlines, right? They have to come up with a question and let's debate it. Was it rushed, right? So you look at the news, you say, well, they're asking each other, was it rushed? They're asking the public, they're asking these experts, was it rushed? Maybe it was rushed, right? Yeah. And I made the analogy of like lab technicians running around quickly with beakers and stuff and spilling them. Like it may have been rushed in the sense of through the hoops that it has to get through for approval, right? But these things that we have to debunk on a daily basis. So the one article that I came across that you had wrote, I believe it's how I found you, was your critique of another article about COVID-19, a tale of two, or your article was COVID-19, a tale of two articles. And you were discussing the one that's called There Is No COVID Heart, and regarding myocarditis. So we've heard about this condition with both getting it from COVID, but also from the vaccine. So could you elaborate on what that initial article was about and what your critique or your praise was?
Yeah, so there was an initial article, and I'm not a cardiologist, so one of the authors I think of that article was a cardiologist, so he knows more than me, and he was pushing back along with a couple other people about this idea that COVID really attacks the heart. There was an article, study from Germany that something 70% of people with COVID get myocarditis. There was an op-ed in the New York Times. Some they were calling it like a ticking time bomb. I forgot exactly what it was, but just that we're going to have a tsunami or a big wave of myocarditis, which is inflammation of the heart due to COVID. And the first article I think was very reasonable. It said, yes, COVID, like many viruses, can affect the heart, but there's no, it's not sort of a heart virus. And there's no sort of special reason that people who recover from COVID should worry about their heart. I thought it was a solid article for the most part. The issue is that this doctor and a couple other authors on the piece seemed to completely shift gears when it came time to vaccine-induced myocarditis. So with the virus, they were saying things like, most people are going to recover. They don't have any special reason to worry about their heart. Reasonable stuff. With the vaccine, and these two articles that I discussed were 6 weeks apart, not a great amount of time. They were saying with the vaccine, myocarditis can cause scars, never call it mild. So it just seemed to be sort of equal and opposite reactions to stuff caused by the virus. No big deal. Stuff caused by the vaccine, freak out. And the one critique that I did have of the original article was that it didn't mention MIS, this inflammatory disorder in children, which happens in about 1 out of 3,000 children who get the virus. Even if they don't have a severe time with it, after they seem to recover, they can have this sort of severe autoimmune reaction. It's affected about 4,500 American kids so far. I know you're from Canada. All my stats are American, so forgive me.
Ours just, cut it to a tenth, and that's here. So,
and these kids can have severe myocarditis. Where they wind up, and be very sick, needing to be intubated. And, if you look at children who've gotten, and young adults who've gotten vaccine myocarditis, so far, as far as I can tell, they all seem to recover. Obviously we'll have to wait months and years to really verify that, but that doesn't seem to be quite the case with MIS myocarditis. I mean, I personally think all these kids, I hope, will be just fine, the ones who survive. But it was just this sort of attitude of, the virus, the vaccine, panic. And that's an unfortunate theme that a lot of, that not a lot, but a couple very influential doctors, I think, have done this pandemic. And that's been a theme, and it will be a theme of a lot of my writing.
Yes, it is very intriguing that everybody has their sort of leanings or maybe a bias of some sort, or the way they interpret the data, and then they're going to write an article with their expertise, and they're going to be read and followed and retweeted, and it's tough for the average person to navigate all this stuff. That's for sure. So you've also been vocal, like we're talking about COVID in kids. Now we can get into maybe like the law of large numbers and explaining that. But how do you see, or how do you perceive COVID and how it affects kids in general? And we know the pandemic has different effects in different regions and that sort of thing, but what is your general outlook?
Yeah, so I think the law of large numbers applies. I mean, the overwhelming majority of kids who get COVID are going to be fine. And it's important we don't forget that. And I have mentioned that in every single article that I've written. I think the death rate for children, hopefully Delta won't change this. I'm a little bit worried it might, but it seems to be about, 1 in 40, 1 in 50,000 children who get COVID will die. The number who've been, the percentage who will be hospitalized is definitely higher than that, but it's still, I've seen some wild estimates here, because no one really knows exactly how many kids have had COVID, but maybe 1 in 3 or 4,000, in other words, if my kids got COVID, I wouldn't have been happy, but I wouldn't have lost a ton of sleep. I'm going to be probably more nervous when my daughter gets behind the wheel of a car for the first time. Having said that, multiply these rare harms by tens of millions of kids who've probably gotten COVID at this point, and the numbers began to add up to, non-trivial numbers, at least in my opinion. And you can minimize COVID for children just by focusing on the denominator, like, 0.0001% of children will die, 1 out of 50,000, et cetera. Or you can simply say, and again, I've seen some various numbers, but I'll just to round it to a number. I'll say, around 500 American children have died of COVID thus far. And I think most people wouldn't blow off 500 dead children, tens of thousands hospitalized, some of them, it's about a third of them, very sick in the ICU. So if you put it that way, that begins to get most people's attention. And you asked, it's very interesting. You said, what were you thinking January, or 2020 or December 2019? I think if you had said to people then, a virus is going to come and it's going to kill 500 American kids, most people would say that's pretty bad, right? That's a horrible thing. But because it kills so few children, as a percentage of people who get the illness, and because many more adults have died, I think that tends to be minimized. And who knows, the virus may be taking a nasty turn. The American Academy of Pediatrics upstates a death count every week or so, and it doesn't get reporting from all 50 states, so it's not perfectly accurate, but they added 24 kids this week. And, 3 kids dying a day of a disease that is now preventable, at least in children 12 to 12 and up. It's a big deal. It's kind of like a school shooting, right? If
Right.
24 kids were killed in a school shooting, I don't think anyone would say, yeah, but there's 74 million kids in the United States, or, kids are more likely to drown, all of these statements that are true, but sort of used to detract from how COVID is affecting kids.
Yeah, there's a lot going on with that, in the sense that we get used to the pandemic. As the months go on, we become complacent with numbers and with the stats, and we compare things that maybe don't need comparing. And a lot of these things are perceptive. It's like, does X matter? Does Y matter? Do you care about this? Do you care about the number of kids that are died? Is 100,000 deaths bad? Is 800,000 deaths bad? Like, at what point does someone change who didn't think 100,000 was bad? Like, how high does the number have to get for someone to go, actually, yeah, it is a bad thing. But of course, there seems to be a difference between sort of doctors and professionals and those types who understand stats a little better, or rather to avoid their own biases better than the average person. Like, we have the average person has a lot of sort of perceptive biases, I'm guessing.
Oh, doctors are not better at this.
Okay.
Zero. Absolutely not. I mean, we're just as human. And as a matter of fact, almost all of my writing has been focusing on doctors who I have felt minimize the pandemic in one way or another. And that has been the one theme of my writing. And they've minimized the pandemic in many ways. I think they've minimized the pandemic in two ways. Getting facts wrong. So the number, and at this point, I'm going to shift away from talking about people like Kelly Brogan, who, a year and a half ago, of course, she's going to say, that it's all a plot to sterilize American women for God knows, who knows, right? And shift more towards people who have stellar academic credentials. They're full professors at, the most prestigious medical schools in the country, are highly published people. Some of them I really admired before the pandemic. Unlike Kelly Brogan, I see them accused of this. I don't think it's true. They're not clearly grifters. They're not selling anything. They're not selling their online courses. I mean, one of them is selling a book, but so am I. I mean, there's nothing wrong with writing a book. And it's a very good book, actually. I read it. It was an amazing book. These people have done, I think, two things. Number one is some of them, have made just egregious factual errors. I can't explain it. And I'll tell you what some of those are. So one of them, a full professor at Johns Hopkins, wrote in the Wall Street Journal, something along the lines of, actually, I pull it up here. I can read the whole thing.
Sure.
He said, after reviewing the medical literature and news reports and in talking to pediatricians around the country, I'm not aware of a single healthy child in the US who has died of COVID to date. Okay, so he wrote that at the end of July or earlier this month. I mean, not that long ago. And it's just ridiculous. If you Google healthy child died COVID, I found 10 examples of healthy children who have died of COVID. And it's just, I can't imagine why this doctor would make that error. I mean, again, don't get me wrong. It's extremely rare. These stories are so rare they make the news, but they happen. I mean, it's just a false statement. Another one said at the end of June, something along the lines of the Delta variant is 1/3 less contagious for children than I'll read it exactly. That children are 3-fold less likely to get any infection with any variant than with the ancestral strain. Okay. That's obviously not true. So just these blatant factual errors. And I can't explain it. I don't know what's happening. So that's way number one, that the harms are minimized. Way number two is probably the more common way, where instead of getting facts wrong, they just don't have any facts. They'll just say COVID is, severe outcomes are rare in children. Which again, I agree with. I mean, that's true, right? I mean, 1 out of 50,000 dead kids, or 1 out of 50,000 children, who died. If you can't use the word rare to describe that in medicine, you can't use, anything. But again, multiplied by the millions of kids in the US, that adds up to numbers that I think most people wouldn't be like, totally blow off. Like one kid dies every 5 years of the brain eating amoeba. We don't worry about that disease too often, nor should we?
But one of the reasons we should worry about it is because it's preventable. Is that not correct? Like, some people think that for some reason they're still under the impression that the vaccines are dangerous or don't work or something like that, where then they say, well, the pandemic is the pandemic. We just need to let it take its course. Right? Like, could you imagine if we just let the pandemic take its course from the beginning without any public health measures or any vaccine? Like, what would a world like that even look like? Is it possible to even imagine that?
So a few things. So yeah, I mean, millions of Americans would have died. I don't think there's too many people who said that with adults. So let me be clear. These doctors who I've been critical of, we all pretty much see eye to eye on adults. They recognize it as dangerous for adults, and they suggest that every adult be vaccinated. I actually think that they don't say what you just said about we should sort of let it rip in kids. They wouldn't say that. I would admire them more if they did, because that's essentially what they're saying. They're not saying let it rip, but they are saying to varying degrees do nothing to try to stop it. Don't close schools, don't wear masks, don't get vaccinated. And so what's their plan? And I know very much what these doctors are against. I don't know what they're for. So if they just have the courage to say, we should open schools. I expect almost every child will get COVID. 1 in 50,000 will die. 100, that means potentially hundreds of more American children would die. But that's the price I'm willing to pay to keep schools open and keep kids learning and to keep them socialized. They may have a reasonable argument. They say, pre-pandemic, we took that risk with cars. I mean, it's a little bit not an apples and apples to comparison. Cars aren't contagious. Cars don't have exponential growth in terms of car accidents, but they could say, listen, pre-pandemic, cars killed 600 kids a year, which is true. And certainly some of those kids died going back and forth to school. We accept that certain children will die on the way back and forth to school. We don't close schools for that reason. That would be more intellectually honest to me than if they just said, no masks, no vaccines, the harms are rare. Mm. They just sort of dance around, in my opinion, what all of their strategies to contain COVID, which are no strategies at all, at least for kids, would imply.
Now, what about the 0 to 12 group? When are we expecting? Is this because of clinical trials, or what are the risks there with vaccines, or why haven't we got to that point yet in the pandemic?
So the answer is just because the studies haven't been done. The studies for the vaccines were ordered in a very conscious way. They were studied in adults 18 and older. And so there's this idea, if there's going to be a side effect, we would rather have adults have it rather than kids. Mm. And then they did the studies in the 12 to 17-year-old group, and the studies for the kids are sort of now enrolling. And, there's a debate about, and, the debate doesn't really matter because the FDA is not going to authorize any vaccine until the studies are done, until the studies have been proven safe. Or at least as safe as you can do in any study. There's limitations to these studies, namely that you can't enroll hundreds of thousands or millions of people in the studies. The main problem with these studies is they can only enroll a couple thousand children. And until those studies are done, and they usually wait 2 months until after the vaccine, the last child got the vaccine, because almost every single side effect, including the vaccine myocarditis, occurs within a few days or weeks after getting the vaccine. Long-term side effects with vaccine are pretty rare. It's almost like if I drank 20 beers tonight, I'd be really sick tomorrow, but you wouldn't expect me to get cancer in 2 years. Or if I did, it wouldn't be because I drank 20 beers tonight. Mm. So I've heard different things about that. Whether the vaccines are going to be available, probably sometime at the end of the year or early next year. And so this is a very dangerous time for children in America, in particular, and all over the world. In particular in the southern states. If I had a 10-year-old in Georgia or Mississippi, I do have a niece, or Louisiana or Florida or Texas or Tennessee or any of these states, especially if that child had some underlying condition. I would be very nervous. And let me just say a word about those underlying conditions. The most common underlying conditions are obesity and asthma. Mm-hmm. In other words, these are children who, when they die of COVID, they're robbed of decades of life. It's not as if there's some child, who has terminal brain cancer and that child is going to die on Friday, but they die on Tuesday because they got COVID. These are not children. These are children who are robbed of years and years of their whole lives, essentially. So if I had a child like that, I don't know what I would do. I don't know.
Yeah, we're obviously, again, I'm up in Canada, but we're looking at the numbers, and yeah, you mentioned Florida and Texas, and the hospitalization numbers are not good. We even in British Columbia, for example, here in Canada, we have very high ICU rates popping up again. And 2 provinces have announced mandatory vaccination so far, Quebec and BC. Here in Ontario, a lot of people are hoping that becomes the next step, where you're already seeing it with the Blue Jays games in Toronto, for example. You're seeing it with local, sports arenas, various things like that. Mandatory vaccine seems to be an effective tool at this point, it creates upticks, at least that's what we see in the data here in Canada. How do you see that as a tool in America? Because we have a lot of places with very low numbers still. We know of the certain ones that are popping up, but as far as statewide and federal mandates.
Yeah, so I mean, I think we have to be really careful about what this means, because this plays into sort of a lot of anti-vaxxers' fears, of the all-powerful state. Even pre-pandemic, they sort of engaged in, I read this term the other day, I think it's great, these oppression fantasies. Some of them have even taken to wearing yellow Jewish stars, which is just an appalling and disgusting behavior. So I think we need to be very careful. So, the government is not going to come to anyone's door and strap them down and forcibly inject them with anything. Okay. So, when you just say the phrase mandating vaccines, that sort of feeds into their paranoia, but almost their hope, right? I think some of these people are sort of desperate to be victims and desperate to be oppressed so they can fight back the good fight against.
I thought that was the left. That was supposed to be the left that was all into being oppressed, and but it seems to shift.
It's a big shift. I mean, if it really was the left, I mean, a decade ago, I would have said the same about the anti-vaccine movement, that it's all the sort of hippy dippy people on the left.
Yeah, it's a little both, right? A little both, but
I mean, I think these days it's much more likely to be the right. That's what the numbers show. And my second favorite podcast besides yours is something called Conspiratuality. I don't know if you've heard of that podcast.
No, I'll check it out.
Yeah, I mean, it's great. It talks about the sort of overlap of the yoga world and MAGA and all these sort of wellness influencers who are really, very Trumpian. But, your original question was a good one about mandates. And yeah, I mean, I think the more that the lives of unvaccinated people are restricted by private industry, the better. I think that, New York City, you have to, I ate inside the other day and I had to show proof of vaccination. That was great. I've been to a couple of concerts. I had to show proof of vaccination. That was great. And I think New York City is doing amazingly well. It's the whole Northeast of the United States is doing much better than the South for that reason. I mean, we're not out of the woods, and the Delta variant has definitely changed the game. But the more people who get vaccinated for whatever reason, the better, in my opinion.
Yeah, it's interesting. We're seeing, like in Canada, we have, I believe, if not the highest, one of the highest vaccination rates on average. And like in Ontario, we've just hit 83% with one shot eligible, which is amazing. But people sometimes think, oh, that number's great, so maybe I don't have to get it because the numbers are already super good. But at the beginning, we heard these numbers about herd immunity, like 70, 80%, but that was of total population. Now we're talking of eligible. And then, of course, things change. The science changes. We have Delta to deal with now. We're seeing this fourth wave and the numbers are just creeping up. And now they're hoping for, 90%. And I can see sort of the argument that people say, oh, they just keep changing they're moving their goalposts in a sense. But it's the virus. I think we have to get away from this mentality of us versus them, or it's the government versus the people. I try to tell some people that, you should think of it like humans versus the virus, not, the people versus the government, because that's how a lot of things are framed in the modern day. And, in our society, especially in the United States,
So I think there's a lot. So let me just make one comment about herd immunity. First of all, herd immunity is a very local thing. So you can have herd immunity in one neighborhood, even one block where I live in New York City, and not have it in the next block. So in New York City, pre-pandemic, 2019, there were some measles outbreaks here, even though something like 95% of the city is vaccinated against measles. Now, measles is the most contagious disease there is. But as long as unvaccinated people cluster together,
yes,
there will be outbreaks of COVID.
Mm-hmm.
And I think everyone is going to get, pretty much everyone on the planet will get immune to COVID, I think, one way or another. It's just a question of, do you get there through the vaccine or do you get there through the virus? I think those are the choices for most of humanity. Yes, maybe there are some sort of very isolated, villagers in the middle of, the tundra of Alaska who can avoid it or something like that. So, I think that there's a lot of people, you mentioned, government versus the people. I think there's a lot of people who, and this is what some of these other doctors, in my opinion, do. They do the opposite for the sake of doing the opposite. In other words, if the vaccine was treated like ivermectin, if the FDA said, don't take this, it doesn't work. If know-it-all doctors like myself said, don't take this, it doesn't work, they would rush out and get the vaccine. If the FDA banned the vaccine, you would see a rush on pharmacies. If they, people,
right.
They would call it a suppressed miracle cure. They would say, of course, the government doesn't, doctors don't want you to get it because they make so much more treating it. They don't want to prevent it. So there's a little bit of the sort of that, whatever I'm told to do, it's almost like a toddler, in my opinion. When my kids were young, you'd say, put this over there, and they would, put this toy away, and they would make the room messier just to be oppositional. A lot of adults haven't grown out of that.
What do they call it? Was it you who coined this or someone else on Twitter? Obligatory contradiction, something like that.
It wasn't me.
Contrarians, yes.
Right. I think a lot of these doctors did very good work pre-pandemic, because what they did is they said, let me look at what other doctors are doing and critique that. And that's very valuable because, we're like anyone else. We tend to sort of do things that we were taught just because that's how we were taught to do them. And are they really the right thing to do? Someone needs to sort of take a step back and say, do you really need to draw labs on every single patient every single day while they're in the hospital? Do you really need to wake up every patient in the hospital every 2 hours to take vital signs? These crazy things that we did until someone took a step back and said, hey, you don't need to do that. The problem is, I think, as this obligate contrarianism, they couldn't turn it off, right? So when every other doctor is right and says, COVID is very serious and it can really impact kids at times, and the vaccine is safer than the virus, they just couldn't stop. They said, oh, I got to be different. If every doctor is saying this, they must be wrong the way they were pre-pandemic.
Right.
They would never say that, of course.
Interesting. There's this idea that will never die, and it's actually a group of ideas, but they're all linked together. And it is this concept that I could explain it this way. Somebody made a post and they may watch this episode or they may watch this podcast. So if they watch it, I'm not going to call their name, but they'll know that I'm trying to debunk them directly. But it was a slide of 10 images, and it was different ways the government could deal with the pandemic. Okay. One of them was closing fast food restaurants. Okay. The other was banning smoking, right? Meditating, sending door to door zinc and vitamin C and all these things. Now, there's a litany of these things, okay, which we may call healthy lifestyle things, I guess you would call them. But none of those things would impact a pandemic in the moment. And none of those things are a vaccine. And people sometimes think of the vaccine as like this Band-Aid medical solution, some sort of intervention that we don't really need. If we only lived our lives healthier, we wouldn't have the hospitals overrun because people with obesity and these different things. But they're all good goals to sort of lower smoking rates and sort of increase the healthiness of the diet in general. But those are more long-term goals that people are already working on. It's not like we just all of a sudden one day realized, oh, we got to stop smoking. Like, people have been trying to stop these things already. So it's this idea of just there's a different solution that I have that that's in opposition to whatever the mainstream is. How can we debunk that stuff?
Yeah, so it's hard. We're not cult deprogrammers. That's for sure. But I think the good that debunking does is often invisible, right? I mean, who knows how many people read a debunking thing and decided to get the vaccine, right? Probably a lot. And if we refuse to debunk things, you can't debunk everything. It's whack-a-mole. There's way too much out there. But if people of good faith and who believe in try to follow the evidence are silenced, then we sort of cede the space to the disinformation doesn't. And, you're right. We've tried to stop smoking for years, and we have. I mean, I think, my grandparents' generation, 50% of them smoked or something like that. My kids' generation is probably going to be much, much less than that. But you're also right that we can't just cure obesity today. Like when the COVID hit New York City, it came on like a tsunami. And yeah, we couldn't just cure obesity within a couple of weeks.
You can't just do like super fast liposuction all across the country. Like it just doesn't make sense.
And of course, the Delta variant seems to be really affecting younger, healthier people. Even the first wave, it was a little bit of a myth that, healthy young people were completely spared. I mean, the youngest person I saw die was 23. And he had he may have had undiagnosed diabetes, I'm not sure, but he had no underlying conditions. But I think that attitude comes from something called the just world hypothesis. Just this idea that if you live your life in a healthy way, the world owes you something. You should be fine, right? That if you eat right, don't smoke, exercise, it's kind of like that book, The Secret, the law of attraction, this idea that you're if you do everything right, if you play by the rules, the world sort of owes you. And it's kind of right. The best way to live a long, healthy life is to not smoke, to exercise, not eat too much, get enough sleep, be social, don't isolate yourself. Those put the odds in your favor for sure.
But it doesn't guarantee anything.
It's not a guarantee. Healthy young people die of tragic things all the time that, they weren't supposed to get cancer, but some do.
So the another topic currently is boosters, vaccine boosters. Now, again, I'm no expert. My personal outlook is that it's a little bit of a PR kerfuffle, and it's a little bit of a red herring, perhaps, and that it would work on an individual level, let's say, for certain people. But as a blanket solution, I'm in the camp that thinks that COVAX is a better focal point to end the pandemic globally. Is that we need to get more vaccines into more arms. So any thoughts on that?
Yeah, I mean, I'm seeing sort of conflicting things about how often the vaccines wear off and in what population. The vaccines do not seem as effective against the Delta variant in terms of getting the virus, but they seem just as effective in preventing hospitalizations and severe illness.
Which is the key thing to focus on, no?
I mean, ideally, you'd like to completely block the transmission of the disease. That
right.
was called a sterilizing vaccine. And that's what I think we maybe had, with the earlier iterations of the virus. I don't think that's true anymore. So I think so yes, you're absolutely right that the best way to stop the pandemic would be to try to vaccinate the world, stop new variants. And the life of a person in America is no more valuable than a life of someone in Southeast Asia or Africa or anywhere. So that's clear. The only thing is, will a individual not getting a booster help someone in Indonesia or Vietnam? Probably not. The worst case scenario is happening, which is Americans are throwing expired vaccines in the trash. Mm-hmm. That's the worst. Mm. So it's kind of like, my dinner tonight. If I don't finish it, I'm probably going to throw out the food.
You're not going to send it over to...
Correct. So yes, in a sort of ideal world, no American would get a booster before the rest of the world, unless there's really significant evidence that it's wearing off, or, maybe this sort of immunocompromised people. But for the most part, no American would get a booster before other countries get their first shot, right? I mean, I could imagine if I was living, I can't imagine, I'm certain I'd be furious if I was living in one of those countries.
Right.
But it's not, you're right. As an individual level, it's not that simple. Someone refuses their third, and I've seen a doctor say this, I'm not going to get my third vaccine dose because, and this was a young, healthy person, so it might not be unreasonable, because it's not fair that people in these other parts of the world don't have them. But his refusing that vaccine dose, it's just going to sit there in a pharmacy refrigerator. It's not going to be sent overseas. So I think they're definitely separate. Both Pfizer and Moderna said they're going to be making 1 billion doses, by the end of the year. So really, the best way to vaccinate the world is to try to do what I did today, following someone's advice on Twitter. I donated $100 to GAVI. That would be infinitely, that's I forget exactly what it stands for, but it's a global vaccine charity that preceded COVID. So if you want to help vaccinate the world, do that. Don't refuse the third booster.
You wouldn't refuse the third booster. I think if in Canada, if they suggested to me, you should get a third one, I don't know if I would. Is that
yes?
bad?
So a young, healthy person, I agree. I don't think there's any evidence that a third booster is going to.
But say over 60 and you have something.
Correct.
Right.
Correct.
Okay.
I personally in one of the vaccine trials, so I got to decide what I'm going to do.
Okay.
Yeah.
And so that's just because we know that antibodies, the effect does lower, the levels get lower over time.
Yes, I mean, antibodies are not necessarily equal to immunity. I read this article once that said, if we had antibodies to every virus that we encountered in our blood, it would be sludge. So what really matters is not do you have antibodies, but how quickly can you make them if you encounter the virus again. So
what I've heard is that the booster will increase the antibodies, but it may not broaden the effect. I don't know if that makes any sense.
Yeah, I mean, we're learning about this in real time.
Right. Yeah, it's super tough for a guy like me who has no training or expertise in this.
Yeah, but I mean, even the experts really don't know. I mean, because the virus changes so quickly. They're just, I think, guessing. And what it shows is how, and this has been a problem with a lot of this pandemic, is how do you make decisions with uncertainty, right? So this gets back to, should you vaccinate children younger than 12, right? So let's say I was a pediatrician and a mother of an 11-year-old child came to me and said, in Florida, and said, listen, my kid is 11, he's starting school. Let's say this child is, obese and has asthma. He's much bigger than, dozens of 12-year-olds I've vaccinated. And the mom says, listen, I'm sending my kid back to school. No one at his school is wearing masks, and they've already had 20 kids go out sick with COVID. I don't want my obese child with asthma to get COVID. Should I vaccinate them? You'd be allowed to do that as a pediatrician. You could get in trouble, I suppose, if there was a side effect because you're doing something off label. But this has been a lot of problem with the pandemic is do you wait until you have perfect evidence from the gold standard randomized double-blind placebo-controlled trials? And you can't, you just can't always do those things. So there are some doctors who are against masks currently because they say correctly, there's no randomized trial showing that they work. Mm-hmm. That's true of a lot of things in medicine. And, if we wait, we could do a randomized trial of masks, I suppose, and then we'll know exactly what to do when school starts in 2 years, mm-hmm. when the results are known, or maybe next year if everything goes well. But you need to make decisions tomorrow, as you pointed out.
Mm-hmm. Now, so we have a lot of bad numbers in certain states and certain countries, and any predictions or any outlooks that you see heading towards hopefully in the endemic times of COVID. We don't know, I guess, if that's going to be 6 months, a year, 2 years. Any thoughts going forward?
I mean, I was, like everyone else 3 or 4 months ago, I was very optimistic. I am still optimistic for vaccinated people. I think vaccinated people as a group are going to do pretty well. I think America and probably Canada, you guys are doing better than us, but I think the unvaccinated states are going to be in for, already 1,000 Americans are dying per day. And I don't see a pathway for that ending. And, at the beginning of the pandemic, everyone felt so bad for us in New York City. We're going to get off easy compared to the rest of the country, especially the South, because COVID hit New York City. It was like an earthquake. It was a horrible thing. And it was very damaging, but it was short.
Right.
And, the rest of the country, it's more like a drought, a natural disaster that's just going to last and last and last. And, a lot of doctors are going to be, and nurses are going to be very burnt out.
Yeah, you already see a lot of anecdotes from nurses and doctors about depression, anxiety, just heightened psychological states and wear out and physical ailments and quitting, right? Is it not true that many nurses and doctors are just quitting because they can't handle it?
I don't know. I don't have the numbers, but I mean, and I think it's also different. Another thing that was different about New York is there weren't vaccines then, so pretty much all of the people getting sick now, I'm going to be careful how I phrase this. They didn't choose this, but they chose not to avoid it. And some of them are very nasty to the doctors. I've heard stories of, demanding that they be treated with quack cures and vermectin and,
right.
9 on their deathbed that they have COVID because they're so certain that COVID is a hoax or a mild illness. And, one thing that I thought I understood the anti-vaccine movement, and I thought that the main reason that people reject, or one of the main reasons that people rejected vaccines is just that we had no memory of polio. We had no memory of measles. We had no memory of diphtheria. You want to see what those diseases did, you'd have to open a history book. And I thought, boy, if those diseases came back, people would vaccinate pretty quickly. But I was wrong about that. And people are willing to die for their beliefs. I'm thinking of writing a piece, sort of making an analogy to the last movie I saw before the pandemic, the movie 1917 about World War I. Where
I saw it 3 times in the theater.
Yeah, it was incredible.
It's amazing.
But these brave young men rushing out of the trenches to certain death. That's kind of what we're seeing now, right? I mean, that people are rushing into restaurants. Death is not as certain, even with adults, 99% will survive. But 1% of the 90 million unvaccinated Americans is going to turn out, it is turning out to be a lot of people. So just like those soldiers rushing into battle because they didn't want to appear cowards, they rushed into certain death. That's what we're seeing here. I maybe someone can find a flaw in that analogy, but they're willing to die rather than give up their group identity as someone who sort of rejects vaccines. And that's been the real tragedy. One of many of this pandemic is that whether you're vaccinated or not has become sort of a marker, the same way, who you vote for, do you go to church or not, has become a core part of people's identities, and people will die for their identity.
Yeah, they're taking they're taking their chances, but they're taking their chances with a slightly greater risk, not slightly, but significant. If you look at the comparison of unvaccinated and vaccinated people in hospitals right now, I was just looking at a Twitter thread that had infographics posted from various hospital units, people posting their infographics, and that's the theme across the board, is that roughly 90-95% versus a 5%. And I can understand, I try at least these days to sympathize with all the views, because just to better understand them at least, right? But we do have to change certain minds. I have one further question. This concept of triaging in the hospitals that are super, super busy, where they're triaging based on vaccination status, it's being seen as super discriminatory, and by the definition of the word, it is discriminatory in a sense. But that's what triage is, I'm assuming. How do we make sense of this, and to get people to not? I guess you can't get them to not be upset, but how do we make sense of why they would triage based on survivability?
Yeah, so I mean, I think what you're talking about is if there's 10 beds and 15 patients show up, what do you do? And let me be very, very clear when I'm talking about beds, it's not just a literal bed. It's a team to take care of the person. It's the equipment. It's the medicines, and I think most people, reasonable people, would say that if you try to treat the person who's going to have a better chance of survival, or who's younger, who if a 99-year-old dies of COVID, it's sad, but it's not as tragic as a 5-year-old dying of COVID. I think the medical ethicists call that fair innings. That's their sort of term for trying to save younger people. I think if you start to prioritize vaccinated people on a sort of moral sense, that these people tried to do the right thing and they were just unlucky, as opposed to unvaccinated people who made a bad decision, you begin to a very slippery slope, where you don't treat anyone who uses alcohol or uses drugs or drives.
Well, and that's the comparison being made now. Is that
right?
Is that
So I think the only reason to potentially prioritize vaccinated people is that they're going to do better, that they're going to have a milder course, that you have a better chance of.
But isn't that triage? Isn't that how triage has been working all along? Or is this a new concept, or
it's a new concept because we haven't run out of beds until now?
Right.
So that's why so that we haven't had New York. Some of the hospitals in the boroughs, actually, the outer parts of New York. I live in Manhattan. I'm very sort of central. Some of the hospitals in Queens did. They were just deluged, 100 people showing up in an hour. But for the most part, thank God the United States hasn't faced that situation until, it's getting that way now in a lot of southern hospitals, where they're converting cafeterias into hospital wards and canceling all sorts of surgeries. And I read about some guy who was shot and needed surgery and had to wait 6 days to get it. And they're trying to ship patients from Texas to Minnesota. So yeah, I mean, if you have two patients and one has a 10% chance of living and one has a 90% chance of living, you try to treat the patient who has a 90% chance of living. Hopefully not so few vaccinated people will end up needing to go to the hospital that they won't have to make those decisions. But that's and I think the main sort of driver behind that is they're just going to have a better chance of success.
Seems like a harsh reality that people are having a tough time swallowing that pill, but that's sort of how it works.
Yeah, no, I mean, it's like something out of a, movie or ethics textbook, that you never, the trolley problem.
I can see a lot of COVID stuff being in textbooks decades and decades from now.
Oh, yeah.
It's going to be a lot of documentaries and looking back. And actually, that's something I'm very interested in, is seeing in the far future, like how we watch documentaries about World War II now, but during World War II, well, especially because of the lack of sort of technology, but they didn't know what was going on, over there. They had no idea. Only looking back do we know. What's
interesting is the last pandemic was forgotten. Right. I did read one book on it a few years ago, but I think I was about the only person. Actually, George Bush read a book on the pandemic and became very interested in pandemic prevention. But there's no memorials to, the 1918 flu, even though it killed more Americans than World War I and World War II combined. We can't think of any famous names lost to the pandemic. It just sort of, and it was really, I think, the end of the pandemic that really ushered in the Roaring '20s, to be totally honest with you. And what's interesting is every single debate that we're having now, minus the vaccines, but every single debate about masks, about churches congregating together, they had back then. I found a bunch of old newspaper headlines from 1918. I can try to send it to you and maybe you can post it in the show.
Definitely.
Everything, someone was fined for being an open-faced sneezer. I thought that was pretty hysterical.
Right.
But they had anti-mask rallies, everything. And when this happens again in 100 years, hopefully 1,000 years, there'll be the exact same thing. It's just how humanity is. Every plague in history, people react in different ways.
Well, there's a lesson there, I think, and something about human nature. And maybe that's the topic for another episode. But Dr. Jonathan Howard, man, thank you so much for your time and your expertise and all the knowledge. And we wish you all the best in New York and in America. We hope the pandemic becomes endemic at some point soon. Knock on wood. Yeah. And let's plug. You mentioned you have a book, and can people follow you on Twitter? Where should they look for you?
Let's see. I'm on Twitter. It's I think it's J Howard Brain MD. I wrote a couple books on neurology. Would probably not be interested in those. But I did write a book on sort of errors doctors make called Cognitive Biases in Medicine. Just look me up on Amazon. it's really, in my view at least, that's sort of a medical textbook as much as it is sort of a critical thinking textbook. So if you like books like by Daniel Kahneman, Thinking Fast, Thinking Slow, that's really sort of what I tried to model it on. So thanks.
That sounds awesome. Yeah, no, that's great. I'd love to check out that book. Maybe I can get a signed copy one day. We'll see.
Appreciate it.
Okay. Yeah. Thanks again and all the best. And we'll follow you on Twitter. We'll continue to follow you.
All right. Thank you.